Hey everyone, welcome to Let's Talk About the POTS Life, your go-to podcast for all things POTS. Whether you're living with POTS or supporting someone who is, this is the place for you. Welcome back to another episode of Let's Talk About the POTS Life. Today we have a very exciting guest with us, Dr. Marie-Claire Seeley, and she is coming to us from a whole different time zone. So to get this to work, we had to, do some calculations, but I'm so glad to have her joining us. So welcome.
Thank you, Kelsey. I'm really excited to be on the podcast. I love what you're doing with this, and it's great to see so many more people out there talking about POTS life.
It's crazy because I'm sure, from all of the research and all the things you have done is some people, I think POTS is a new word, but it's been around for quite a while. So we can dig into all of that. But why don't we start with just you telling us, one, who you are, a little bit about you, and then how you kind of came into this world of POTS. And I know there's an EDS component, and then, just start from the beginning.
Sure. So the beginning was a long time ago. And I have come late, really, to the POTS research world. I think a lot of people are like that, actually. But so I'm a grandmother, actually. I'll start at the other end. I'm a grandmother of 6, mother of 4. I'm an academic at university and a researcher, but I'm also a clinical nurse background. Emergency care was my kind of background. But really, the POTS engagement started a very long time ago, back in 1993, which is slightly serendipitous because that was the year that the name POTS was actually given to the condition that had been known for, centuries. Actually, it was first written about in the 1800s, but it was given all sorts of evolutions of names. And then in 1993, it was actually called POTS by Philip Lowe in Mayo. But that same year, I was a young bride, and my husband and I had traveled to the Middle East where we were setting up life, and we both got a virus. And my husband actually got really unwell and ended up in hospital. I remember being quite unwell with fevers, but then I recovered. But then this new experience kind of just came out, and that was that every time I stood up, I couldn't see or hear. My ears would be roaring. I felt like my heart was jumping out of my chest and I might faint. And that was the beginning of a very, very long journey. It was pre the Google era, so I couldn't ask people what was going on. I couldn't find a Facebook group and ask other people what was going on. All I had was the occasional doctor I came across, and all of them told me the same thing, and that was, this is anxiety. So that's where the journey began.
And knowing your body, and I think we all go through this, we're like, oh, it's anxiety. Okay, in my head, I knew it wasn't anxiety, but you start to trust what they say because there's no other smoking gun, especially early on to be like, that's what this is. So I remember saying to myself, well, am I anxious? Of course you're anxious when you feel that way, but I knew it didn't stem from that, but you almost talk yourself into it.
Yeah, you start gaslighting yourself, right? So I actually did write diaries back then, and that's really helpful. And a couple of years ago, I was actually writing a chapter in an academic book about people with lived experience becoming researchers, and it's a book about research partners. So I told a narrative story of my own journey, and in that I thought, I've got all these diaries. Let me see if I wrote about this experience. And disappointingly, I didn't write much about what I was experiencing in terms of the POTS symptoms. But what I did write about was a couple of times after each, doctor that would come across or search out, I would write things. And somewhere along the line, I wrote, I'm starting to wonder if the doctors are right. This, one day I'm fine, and then the next day this comes back and there's no explanation for it. It's just back. I can't do anything. And I was starting to gaslight myself. Previously in the diaries, I'm like, at one stage I wrote, this isn't anxiety. I know what anxiety is. I have to get on an Aeroflot plane every so often. And if
Right.
your listeners don't know, Aeroflot was the old airline in the USSR, and it was notoriously unsafe. And
That's
some
anxiety.
pretty random things would go on. And that was anxiety. And I knew I wrote in the diary, I know what anxiety is. This isn't it. It has a lot of the same feelings, like your heart races, but it's random. It comes at that time, unbelievably. I hadn't figured out that it was related to. It took me a long time to realize it was related to standing up. I don't know why. And then the other thing I didn't realize was that it was very much heat induced, and I was living in the Middle East, and then we moved to Central Asia, where it was like 50 degrees Celsius every day. So, 100, kind of 10, 115 in the desert.
Oh, man.
And I was wondering why I wasn't managing, Yeah.
It's sad because we do. I mean, gaslighting is the perfect word, but we almost like make excuses for ourselves. It seems so simple to somebody. Well, how did you not notice it when you're standing up? But when you get these feelings so often and you're being told it's one thing, and we just add confusion to ourselves. Now, at this point, were you already working in the emergency room or the healthcare background? So this was still all, you had no idea.
Yeah, I hadn't gone on to university or college, as you call it. It wasn't kind of as much of a mainstream thing to do in Australia back then. I had wanted to go out and save the world, so I went out to work as a humanitarian worker, and it was at the time of the Iron Curtain falling down, so I was working in Eastern Europe, and that's where I met my husband, who happens to be Australian, but we both met doing the same thing. And I was just keen to really be out and be doing. I didn't want to go spend, time back in university. But it was actually through that work that I got to take a lot of medical doctors and nurses out into some of the Romanian orphanages that we had come across in our work. And I just knew from day dot, I loved it. That's what I wanted to do. But then it was also my experience, when I had this POTS come on, I had not really had much engagement with doctors over my lifetime. I was fit, healthy,
young,
young, athletic, and you don't have much need for doctors.
No.
And so, my first engagement with them, I was just totally assuming that they would fix me. Like I just went in there, I have real symptoms. They're measurable, because by the time I saw the first doctor, I realized this was my heart racing. And I'm like, oh, wow, I can't even count my pulse when I'm standing up. So this is a real thing. The doctor's going to figure it out. And not only did they not figure it out, but they had no interest. It was clear that this kind of curtain came down over their face as I described my symptoms.
Jeez.
And on reflection, I know that immediately those doctors had gone to what they'd been told, and that was, this is a young white woman who's complaining of her heart racing, who looks fit and healthy in every other way. We know what this is. This is anxiety. But they didn't even have the kind of the guts really to say that to me. They just kind of went, oh, there's nothing wrong with you. And I'm sitting there going, there's clearly something wrong with me. I just barely made it into your doctor's surgery without fainting, but there was nothing on offer. So that experience was very confronting to me, and I'm not given to depression or anxiety, which I'm really thankful for. I didn't have those experiences previously, but I got really down over that. I just remember being completely confused, and I felt like, somebody had accused me of a terrible crime, dragged me in front of a court, and then said, you can't say anything and you can't defend yourself, and we're just going to, give a ruling and off you go. Like, I just felt that unbelievable injustice of, you didn't even hear my story, you didn't ask me anything, you've made a judgment. It's a wrong judgment, and I've got
Right,
no.
based on how I look and my
Yeah,
age, and I think that's the
yeah,
biggest thing. It makes you feel crazy.
yeah. It did make me feel crazy. Unfortunately, my husband's just Mr. Black and White, and he was just like, "Yeah, but they're wrong." And I'm
Right.
like, "Yeah, I know they're wrong,
But what do
but
I do?
yeah, look what they've done." He's like, "Well, you just ignore them. They're wrong. We'll find someone else." Now, it's not that easy. We did try to find someone else, and we actually left the Middle East and came back to Australia, and exactly the same thing happened, probably even worse. They were more forthcoming with the you definitely have anxiety. So it was that experience, and then I went on, a few years later, we moved away from the Middle East to England, which is cold. And I finally decided, yeah, we would try for children. I started getting better, and I can't pinpoint a day where I was, definitely better, just that it became less of a thing in my life. And a lot of that's around the environment I'd moved to. But then when I got pregnant, of course, a lot of people with POTS find this. I felt a lot better because you have a lot more blood volume running around your body. There is some thought that, it's an autoimmune disease, and we know that autoimmune diseases are suppressed during pregnancy often. So in any case, things got a little better. But then once I had children, I started to realize that the same gender bias was really demonstrably there. I remember my second child was very unwell. I knew something was wrong. I kept going to the doctor. They kept dismissing me. And eventually I just sat there and said, no, I want a referral to a pediatrician. In the English system, that's not an easy thing. You don't automatically see a pediatrician if you've got a child. You only see a pediatrician if that child's very unwell. And this doctor looked at me, and he was furious because I'd been a few times. And he said, I'm going to write a referral, but I'm treating your paranoia, not your child.
Oh my
And,
goodness.
and it turned out that that child was really unwell. She had early onset celiac disease. Her antibodies were absolutely through the roof.
I was diagnosed at 15 months, and my mom,
Yeah.
if she was sitting here, would tell you the same thing. I looked so unhealthy, so malnourished. Yeah, and you just see, she says, like, you see your baby fading from you, just so sick.
Yeah. And my daughter actually maintained her weight, but it had fluctuated vastly. We'd go through episodes of, and it was the screaming and the pain and the
Yes. She
diarrhea.
said, the crankiest, when at the time they challenged, they didn't have the endoscopy, or they didn't have the blood test and the gluten challenge and endoscopy after endoscopy. And she was like, I knew right away when we put you back on, like, look out. Because it was the
Yeah.
screaming and the irritability. And yeah, And
Oh,
I
yeah.
also think you just know in your gut as a mom when something's not right.
Yeah, yeah, absolutely. And I had looked up, I mean, Google was a thing by then. So this is 1997. And I had done some research and realized this is celiac disease. And that's what I went to the doctor with. And they were very annoyed about that. But anyway, what, and those experiences weren't just one or two, they were
Right,
constant. Every time I
right.
took a baby to the doctor, I was confronted with this kind of assumption that I was a neurotic mother. And almost always it turned out there was something wrong. And it was really those experiences when we moved back to Australia. We had 3 kids, and then we had a fourth one. And even through my fourth pregnancy, lots of problems arose with that child. And then that child was unwell. And again, I had to really push to get the right diagnosis, which was correct. And I thought, no, I'm done with this. I'm going to go into
Right.
this
I'm going to
system.
do something
I'm
about
going to
this.
learn. Like, I'm doing the research anyway. I'm doing your job for you. So when my youngest was 6 months old, I went back to university and did a Bachelor of Science and then nursing, and then did my postgraduate studies after that. So I did it the hard way, but it was the right thing to do. I've loved it since the first day. I started studying, and really I haven't stopped.
No, and I mean, you're doing amazing things for the POTS world and all of that. But when did doctors finally put things together for you? Was it with during babies, after babies? How did that look?
Yeah, so doctors didn't put it together for me really.
I thought that might be coming.
What Yeah, what eventuated was I eventually, and I can't pinpoint the exact time, but it was very early on, because Google wasn't the thing actually when I was researching about my young daughter. I can't even. We had this thing called Ask Jeeves or
Oh,
something
yes,
that we
right,
did.
right, right, right. Yes, yes.
But of course, we now just use the verb of Google, and so I did reasonably early on start to discover some of the discussion around POTS, and that was probably in the late 90s. It was more called orthostatic tachycardia then, and then in the 2000s. So I became kind of conscious of, hey, and I do remember the feeling when I read a paper of going, oh, there
This
you
is it.
go. This is me. This is 100% me. And yes, I'm not insane. And we know it's a condition. I didn't seek any diagnosis because at that time there wasn't really any discussion around how this was treated. It was more, hey, this is a thing, and lifestyle changes. By then I'd learnt most of them. I knew that I had to be careful in the heat. I knew that I need to drink a lot of water and so on. And then it really changed when I became an emergency nurse and kind of worked my way through that system. I was seeing more and more patients that would come through. Well, it was a regular thing. You'd see particularly a young woman, but occasionally young men come in, sudden tachycardia, some fainting episodes, all the rest of it. And you would hear the conversations that would go around that
And
in
you
the
would know.
back corridors. And I'm like, yeah, I know what this is, and it's not anxiety, but I'm not going to step into that world and that conversation with that consultant and tell them they're wrong. I would quietly talk to the patients and say, hey, there is this post-viral thing, it's possible this is what's happening to you. And then those conversations just became more and more. And then eventually, when my eldest daughter was 14, she got a gastrovirus and started vomiting. And then she kind of got over the fever side of it, but she didn't recover. And I could just see this snowball of things starting to happen. One thing was that her gut was just terrible. Now, she'd always had a bad gut. She's not the celiac. She's the oldest child. But she'd always had reflux and would vomit just randomly, almost without effort. Even when she was playing in the yard, she had chronic constipation. Anyway, she got this virus and all these things started to happen. She was vomiting constantly. Anytime she ate something, she would vomit up. So she was losing weight rapidly. And she had been a little overweight, and so doctors weren't concerned. And in fact, one doctor, this is a 14-year-old, said to me, I don't know what you're concerned about. She's hardly fading away, was his comment.
Oh my goodness.
To a 14-year-old girl who, by the way, had lost 5 kilos over kind of 4 weeks. So she was, but the other side of that was that she was definitely very potsy, and I could see that. And I was at work one day. I was an academic as well as a clinical nurse. And I thought, right, this child has had a lot of things going on in their life. Pretty sure she's got POTS now, but she had lots of these radial head subluxations, which I call nursemaid elbow, but she'd had like a dozen of them before she was 2. She'd had a brachial plexus nerve damage. She had her coccyx had to be removed because it was so hypermobile, it had flipped up. There was all these weird things, and I said, I'm just going to do a database search. And I put in postural orthostatic tachycardia syndrome, joint hypermobility.
Ding,
and
ding, ding.
Ding, ding, ding. Up popped a whole new world. and it explained everything in my family, all my children's hernias, operations for hernias, dislocations that we had had. And that was really when I discovered the world of Ehlers-Danlos syndrome. And at that point, I'm like, right, there's got to be someone in Australia that understands the connection of these two. And I found the one person that kind of Google knew about was living in Melbourne. And I just wrote him an email right there and then, which I've never actually done that. I've always gone the right way around, but I just wrote and said, look, I'm an academic. This is my daughter's history. Can you see her? And he wrote straight back. And that guy, actually, his name is Chris O'Callaghan, and I don't think he'll mind me saying he never replies to emails.
Right, because, most don't, but that's amazing.
Yeah, correct. And this was a long time ago. It was well over, it was probably 16 years ago. And so anyway, we went to see him, and he's a really funny, unique guy. And he just looked at me. He'd asked my daughter all these questions, she actually did all these surveys. And then he just turned his eyes on me and he said, so, Mum, were you a swimmer, a dancer, or a singer? Yeah. And I was like, well, I was a swimmer. I was kind of state level and some national level. And then I'd gone to a specialist theatre art school because I was a dancer. And I was like, what? And it was all just this revelation that he was in
all the pieces.
Yeah. Yeah. And he basically, he loves doing this. It's his kind of little magic trick to make parents like completely overwhelmed.
All the bells, because it is true. How many, I say all the time, they'll say, oh, I was a dancer. Oh, I was a swimmer. And I'm like, these bodies, they go where where they fit and where they excel, and that is there. Yes,
that's right. And the one thing that Chris picks out that nobody else does, and he wrote a book really around this phenotype, this type of person, but he also picks out that they're unusually good singers. Now, my daughter actually was in the con at the time. She was a conservatorium. She was a jazz singer, and all my kids, I'm not a great singer, so it's clearly not.
I didn't get that. I didn't get that one, but it's
interesting. I wish I got that. But in any case, he put it all together, and there wasn't much at that time to be done, but just to have someone validate that. I think it was more, I don't think my daughter actually felt all that. She was 14. She didn't know why she was vomiting. She didn't know why she felt crap. And she really wasn't given a whole lot of kind of information. It wasn't like somebody gave her a magic pill, so she wasn't too impressed. But for me, it was like the biggest therapy session I'd ever been to.
Just putting all the pieces together. Even I talk about all the time, my son is hypermobile. He's 8, and we're picking up, I'm picking up on all these things. And then my mom just said it the other day, man, I wish I would have known, because now if you look, my mom, POTS issues and hypermobile, my brother's hypermobile, me, and now my 8-year-old, you really do see when you step back, but nobody almost picks up on it till it takes a little bit. So that's amazing for that doctor to do that.
And, now we see the third generation. And, I'm really mindful of not medicalizing what is normal too. I mean, there's an element in which Ehlers-Danlos is probably very common amongst the general population, and there's a lot of gifts that come with it. The very athletic people are often have EDS. I mean, Katie Ledecky, I'm not sure if
she's
I don't know that she's declared her EDS, but I think anybody that knows that she's got POTS and you look at her, you go,
and she swims.
She's a swimmer, and what do you have to be? If you're going to swim at that level, you have to be hypermobile. But I can see it in my grandchildren. It was super, super hypermobile, and it is some of the things I just spoke about this at my conference, our conference that we ran. I usually only speak on POTS, but I spoke on EDS because I really wanted to show that this is not a benign condition, and I followed a family through the generations in the talk and showed the risk for women, particularly with EDS, in terms of all their pregnancy and, reproductive risks are relatively high. I mean, these women are more prone to things like postpartum hemorrhage, prolapses, precipitous births and labors. And those things were really strong in the family that I showed, and very strong in my family. And yet each time my daughter or myself went into a hospital to have another baby, the previous risk that manifested was treated as if it was just coincidental. Oh, we don't have to worry about that.
It was a
that was a one-time thing, But no, it's not. Then you have another bleed, and I'm like, no, we know what this risk is. We need to start screening for it and preparing for it, so that mothers don't have to be traumatized every time they have this thing that we could have predicted. So anyway, my story was, how did I get to POTS? So this is the revelation time. And then I was doing my master's at the time, and I thought, I should really be doing this on this condition. But I had this mindset, which a lot of researchers have, which is, you shouldn't research the condition that you experience because it will bias your outcomes. That's a very common thought process. Completely changed my mind on that. I think it's a complete opposite. I mean, every bit of research that is done is biased because we're humans and we bring to it our own opinion. And
it's whether you have it or not, you're choosing to research that for some sort of reason.
Correct. And so if you leave it to the people with no experience, they're going to be researching things that aren't even relevant, which we now know is the case, of course. So I didn't go into it. And I was pretty well at the time. I mean, I do remember it was always my party trick. I was teaching clinically I was in clinic, but I was also teaching at university, postgraduates, and we were in a lab, and every time I put on a pulse sat, my heart rate would be 130, and that really impressed a lot of the people in the room.
They're
so
like,
I was completely living with that, but it was normal, and my fatigue was normal, and I just got around it.
I always use the comment, like, if you're the party trick person, something's not right. Hypermobile, the high heart rate. If you are the party trick, so you said it perfectly.
And this is another one, and I've never revealed this, so I hope none of my students hear this, but we used to, when I was teaching them how to do essentially urine analysis, so, you all go pee in a cup, and of course all these students would have to run down and pee in a cup and test their own urine. And invariably it was all perfect because they're all young, fit people. But my urine always had blood in it because I'm got the bleeding component of the EDS. So my clotting's fine, but I always had blood in my urine. And so I'd just make sure I had a pot of my urine there because I wouldn't tell them it was me.
They're like, I don't know. It's just a random.
Oh, wait, we just collect this and we put a bit of blood in it. But I always had blood in my urine.
It's because it's part of that. And these are the things people don't even, it never occurs to anybody.
That's right. And that's another one of those things that was investigated year upon year upon year. Oh, you got blood in your urine. You got blood. Yeah, I'm like, I've always got blood in my urine.
Yeah.
And in the end, they decided it was coming from my kidneys, but my kidneys were fine. And so, it's just another one of those what we call subclinical. It doesn't trigger any treatment. It's just another weird thing that is there. So that was kind of where I was. And my health was pretty good and I was managing everything. And then we moved states. So we moved from Victoria to South Australia, where we're living now. And I decided to get uber fit. I used to be fit, really fit when I was young, but I just went through a bit of a health kick and decided that I'd start trail running. We've got beautiful hills around here. The fittest I'd been in my life, and I was approaching 50. It was that real kind of time of life where you just like, your kids are pretty much grown up, more freedom. And I'd done this big long walk of 30 kilometers. Someone can figure out how many miles that is, but it's a long walk.
It's a lot.
And I'd started bleeding into all my joints, which is another thing that I get. And I thought, that's really weird. Like, I haven't had that for years. I've been doing lots of exercise. Why has it suddenly come? And then just randomly, a couple of days later, I woke up, and for the first time in years and years, I woke up, stood up, and fainted.
Oh my goodness.
And it was the start of a terrible, terrible period where I
Man.
couldn't go to work. I was aware that I was urinating a lot. I'd have to get up 3 or 4 times a night. Sometimes I'd have to crawl to the toilet because I couldn't.
Oh, been there, right? Because you can't get up out of bed. Yep. That I always say
Sit
that's
on a
been the lowest of lows when you're crawling to the bathroom. And my husband's like, I've never seen anything like, you're an adult, you have children, you shouldn't be like this, and here we are crawling.
Yeah, and sitting on the floor in the shower. But this time was the first time I ever went back to a doctor for me, in comparison to the 30 years before. And what I found was completely different. It's not like I found people who knew exactly what was going on, but what I found was very compassionate doctors who were like, this is not right. What can we do? As is the way with me. And I think now, looking back, I probably have this MCAS type thing. And so I start to bleed. I had lots of bleeding from my bowel, from my uterus. It was just the whole picture. And in 6 months, I had about 50 units of blood.
Wow.
So we're not talking just a little bit of bleeding.
That's
I
a
was
lot.
in a lot of blood. And it was a long, complicated kind of road to recovery. But suffice to say that being in hospital, in and out of hospital, losing kind of everything and being on my own a lot in a bedroom just really drove me deep into the literature. We actually found in the end, I realized that I think desmopressin might be the drug for me because I was urinating so much. I found a great endocrinologist who was like Dr. House. He sat by my bedside in hospital and
I
we
went through all the things.
He was like, yep, I think you might be right. We did a water deprivation test and lo and behold, yes, I did have a type of kind of inflammatory insipidus, and desmopressin was the drug that got me back up on my feet and out of that hospital. And it was during that time that it was COVID, firstly, COVID came on the back of that really quickly. And during that time, I met Professor Dennis Lau, who's a cardiologist here in Adelaide, who had done some research on POTS, and particularly they'd looked at apheresis or plasma exchange in POTS. And I came across his research and I'm like, oh my word, there's somebody that's actually researching this condition. And I reached out to him and we had a conversation. And he was like, Claire, he calls me Claire and he's like, so much more than I do actually about this condition. Why don't you come and research? And I'm like, no, I couldn't do that. I'm still not well. And he goes, no, you can't leave the earth knowing all of this.
You need to share it.
Yeah, he really challenged me. And I was like, this is your duty. You need to come and do this. It was COVID and everybody was doing weird and wonderful things, making sourdough and starting
all
new
the
jobs.
Things. Yes.
Yeah. So for want of more sanity, I decided that I'd take on a PhD. And I said to him, look, I don't know how much work I can even do. I've come off the back of this 18 months, really, it was that of being really unwell. But I started, and not only did I start my PhD, but we started a new multidisciplinary clinic where it was nurse-led. We started patient registry. And at the very same time, we thought, we realized there was nobody arguing for or fighting for the rights and the advocacy for this group of people. So I started a foundation at the same time.
Love it. I think, just my experience, but starting the POTS life and feedback that I get, and the same thing with you, having the experience to be able to relate to these people, to know, what it feels like to be in those rooms and not be heard, but then also be at home doubting yourself or feeling those symptoms. I just think that brings another level. You can't put it into words. I think how much it means to people.
Yeah. And I think this is I do a lot of talking to GPs and educating. And one of my first question is, who thinks there's an epidemic of POTS? And kind of everybody puts their hands up. And, from my perspective, what has been useful is I've had such a long time living with this condition. What I can see is, I suffered in absolute isolation. There was no ability to find another person with POTS back pre-internet, right? You just had to suck up what was going on. And you might incidentally, if you were sharing, your weird story at a party, you might have come across somebody, but nobody did because you were taught to be ashamed of the condition. Right. And, I was a real go-getter. I was a farm girl from the country. It's a tough, area that I grew up in. I was proud of being strong and able, and, nobody wants to switch and take on an identity of I've got this weird condition that people think is anxiety, but it's not. You don't declare all of that. And what we have now is people no longer suffering in isolation. They're able to find each other. And what you realize when you find people is POTS may be heterogeneous in that it's caused by multiple things, but the experience is very much the same by almost everyone. Yep. And that cannot be a mass, coincidence.
Right.
And
it's too big.
That's what everybody gets when they hear someone else talk, and all those bells go off and they're like, that's me, that's me, that's me, that's me.
Or if it's not them, it's, oh my gosh, my neighbor was talking about her daughter and oh my gosh, she's going through those things. So it's whether it's the person you're talking, there's typically some connection that people can say, you know what, so-and-so's daughter had something weird. I'm going to mention this to them. And you're right. You're so right.
Yeah, absolutely. And so I say it's not, and there's actually a famous quote from David Robinson from the Vanderbilt, he started the Vanderbilt Autonomic Lab and really was one of the kind of grandfathers of autonomic medicine, and has passed away actually in the last few years. But in 1999, the quote that he had was, "This is not an epidemic of orthostatic tachycardia. It's an epidemic of recognition." Oh. And that was in 1999. And I'm like, if ever we can say that, we can say that now. This is an epidemic of recognizing one of the most common diseases and conditions that has been the crime of the 20th and the 21st century, that it has been suppressed and covered up, because these are people on the hundreds of thousands around the world that have suffered with this condition and been told it's all in their head.
It is, and it's so, so sad. But I love that, the foundation, you started it, and all the things, well, we'll tell them again at the end, but where can they find the information? Because I think just the website has so much, and then we'll talk about your conference that you're also doing. But what is the website where they can find it's loaded with great information.
Yeah. So what I realized very early on in the foundation was that people just needed information.
They do.
And so the website was the easiest way to do that. And we wanted information not just for patients, but also for carers and for clinicians. Everybody wanted information. So it's potsfoundation.org.au, and we've very much set up the website as a bit of a journey that you can go through to look at, what are the symptoms of POTS, how is it diagnosed, how is it generally treated. We have a clinician registry there for Australians who are looking for clinicians. And I was at our conference, I was kind of spewing out some of the numbers that even astound me. 10,000 unique visitors, so new visitors, visit our clinician registry looking for clinicians every month. I mean, that's a lot in a small country. We're a country of 27 million. So and something now like 400,000 people are going to our website a year. The majority of those are here in Australia. So it is a huge need. There is such a demand for information, and we've tried on there to make sure we've got lots of resources. People can download templates on how to do a SAN test, how to assess that, so the foundation is we're still a volunteer foundation led, and it's hard work, but we're just going from strength to strength. So we've just had our third conference. We have one every second year. Our first one, we honestly didn't know if anyone would turn up. We'd only just started. We didn't really have social media. Like, how do we find people to come to this conference? And we just kind of sent out lots of emails whenever we could to different groups. And about 80 to 100 people turned up in person, which we were just stoked. You know,
Thrilled, right?
Thrilled, absolutely thrilled. And we had these amazing, we only had two Australian clinicians that spoke. We had a lot of Americans who gave a lot of their time for free and just, zoomed in, and they were fantastic and really set us on a great path in terms of people going, hey, that was really good. The next year we had 180, and we're like, wow, we're really making strides. And this year we had 400 people in person.
Oh my goodness. That's awesome. And share, because I've seen them on social media and the different physicians, because I think, your algorithm works that way. But share a little bit, you have like a clinical side, but then, all the pieces that go into this, because obviously, I mean, that's awesome.
It was a huge effort. We called our conference Converge 2026, and I'm half toying with the idea of just keeping that name. So what we really tried to do was not just focus on POTS, because, there's kind of only so much you can talk about POTS. It's all the conditions that intermingle with POTS that we're keen to explore. And that wasn't just EDS, that was ME/CFS, Sjogren's disease, pelvic pain, endometriosis, neurodivergence, eating disorders. So we had a jam-packed clinical day program, all of those things, fibromyalgia, were all talked about in workshops or from the platform. We had the wonderful Alexis Cutchins come out from New York. She was our keynote speaker, and we just had a blast with her. And then on the second day was our community day, which, we and ah about running each time, because we know for a lot of people it's not possible for them to travel. For the people that it is possible to travel, it's a huge deal to go to a conference. They sit there looking pretty exhausted most of the day.
Right.
But they really, for a lot of people, they always come up after and say, I haven't met another POTS person, to be around other people like this and talk. I think it's actually the networking for them that is the really important thing. So that was our POTS conference this year, Converge 2026. And tomorrow I start planning 2028. So
that's how it works, right? No time for rest.
Yeah.
But I think these conferences give validation. They give amazing information, but I also think, just knowing a patient myself, just when the doctor that I met with at the Cleveland Clinic, he gave me validation. And then I felt less crazy, and all of a sudden, like, the doubt of myself was lifted, and I knew it was real. So I think meeting others, and I say that's such a huge part of this. I didn't know anybody when I was diagnosed. They said, you have POTS, and I said, great. Now what? I don't know what that is. I don't know who has that, and so I think being able to relate or hear somebody's stories, and like you said, so many are very similar, but so many are very different, and they come with these other diagnoses. I always say, when I started my clinic, it was just pelvic floor PT. I did not tell anybody that I had POTS, because I looked fine. And it was kind of that weird thing. How do you tell anybody? And then when my story was shared with Cleveland, and more and more was getting out, they said, oh, how do you go from pelvic floor to POTS? It's so different. And I'm like, you have no idea how interconnected it is.
Absolutely. It converges. And that's exactly it. I mean, we've had a great investment in women's health here in Australia, where we have socialized health. And it has been focused on one disease. When they made the announcement, like, we're going to make, 30 endometriosis clinics around Australia. And I'm like, why endometriosis? It's one of multiple things. But the good thing is that funding got released, and these are GPs, so general practitioner, primary healthcare clinics. Those mostly women that are running those, they cotton on really quickly. They're like, just a minute, we're seeing all these women for their endometriosis, but actually what we're seeing is fatigue, orthostatic intolerance, racing heart,
prolapse, all these things that go together.
Yeah. And so they are the ones that jumped on board really quickly with, I got to speak at the Pelvic Pain Foundation conference a couple of years ago, and I could see all these lights going off. And this happened on Thursday on our clinician day. We had a lot of speakers from different areas. And after each session, they'd come up like, oh, my word, we need to know about this. We work in eating disorders, and we just didn't ever connect the dots, and we're like, yeah, and everybody's connecting the dots. It's all one big condition that is maybe driven by genetics, but definitely affected by the inflammatory kind of side of this condition that many women experience with the hypermobility. And we need to be working together to solve this as a large jigsaw puzzle together.
Yeah, because everybody plays their part, right? I always say, and because they'll say, oh, I just have this low back pain and this unexplained pain, or, we go through, I'm like, you need to see a pelvic floor therapist. And there's a GI component and a cardiology component. And you're right, from a eating disorder standpoint, I think people are a little shocked, or I feel like I find with that diagnosis, people think the most rare, but I actually see so many that have a history of it, and they don't know, it's another thing that's not talked about. And so all of these things are so interconnected. So conferences like yours, the foundation, and all the work they're doing and speaking, how could it not be changing the future? And I hope it, just more and more physicians put the dots together, because you're right, it's huge.
Yeah, absolutely. And I think things are changing, and it'll be different for my granddaughters growing up than it was for my daughters and myself, I think. And, and then I can trace this all back through my whole family,
Isn't that
as
something?
everybody can. Yeah. And I think of my grandma, who was just the most amazing woman, but I'm for sure she was very, I don't know how people did this pre-Google, but she read a lot of healthy kind of eating, healthy this books. And I realized it was because she was suffering from so much chronic pain. But she worked her way through it. She made sure that she kept herself exercising and doing things to maintain it. But right to the very end, ambulances would have to come and get her from the shop, because she would have a dizzy turn.
Everybody has their thing. My mom's grandmother, she always said, after I got diagnosed and all these things, and she said, you know what? My grandma used to have a bad heart, and she would pass out, and we would go get the smelling salts to wake her up. I'm like, well, that sounds a little fishy.
It's exactly right? And, even this whole Jane Austen phenotype of the swooning woman, I mean, I'm not sure that it was the case as commonly as, say, perceived, but what is if this is, if it's not orthostatic intolerance, with a few courses to stop the, people from breathing. But it's definitely, you can see the history in your family. And my grandma, bless her heart, probably got zero support from any doctor, but she managed to know how to live her life to her fullest by doing her own research and managing it.
It's just crazy that, and so many of us have stories like that. And you're right, you trace it back through families and then kids and grandchildren. And all we can do is be more prepared in the future. I say all the time, at least now I'm more prepared for my son, and that's all you can do. And trust your gut. And if you're the patient or you're the mom, the loved one of a patient, just trust your gut, because if something feels off, I say it usually is.
Yeah, that's right. Absolutely.
Oh my gosh. Well, I think I could talk to you all day, because stories are so similar. And if you can't tell by listening, two POTS patients love to talk about experiences change and how we could go about it. So honestly, I could go on and on, but I'm just so thankful that you could join me today.
Oh, thank you so much, Kelsey, for having me. I've been following you on social media. I think the algorithm feeds it in there, but it's just great to see as
Right.
many diverse groups of people talking about this as possible. I think that's the best thing that can happen for our community out there.
Yep. The more we can get out there, the better, right? So tell everybody the website one more time, and where they can follow you, and just anywhere else that is helpful for them to get some great info.
Yeah, so you can follow the Australian POTS Foundation on LinkedIn, Instagram, Facebook. We're not much on Twitter, but we kind of are there, or X. You can go to our foundation website, which is potsfoundation.org.au. And I did a bit of what they call a Churchill Fellowship this year, where I was sponsored by our government to go look at autonomic research and techniques in the US and in Canada, which was just absolutely a blast. And I've kept that page going. That's called Autonomic Journeys. So you're welcome to go follow me on Instagram on that. And every so often I try and do a bit of update that's more a bit about the actual research side of autonomics. But yeah, follow us, and we love to connect with people.
Yeah, I love it. It's so much great knowledge and validation, and, just seeing what the research is and what's coming and what is changing. The more you can arm yourself with things like that, I think it just leads to better outcomes and discussions with your clinicians, and, hopefully just a better result for you feeling better and putting more pieces together all together. So yes, thank you so much for joining us. Thank you for tuning in. Make sure you like, follow, share, all the things for the podcast, and we'll see you next time. Bye.